This is an update for Walker Street Doctors for the 9th of January 2022. Things are in place for us to start to administer COVID Pfizer vaccines to our paediatric population aged 5 to 11 from tomorrow, Monday, the 10th of January. There are good reasons to vaccinate this age group. The vaccine is effective against the paediatric multisystem inflammatory syndrome, which occurs with COVID in this age group. The risk of the rare myocarditis pericarditis complication from the vaccine is significantly lower than their adolescent and young adult counterparts, and the spread of disease through the community, including to grandparents, will be reduced. Unfortunately, though, we, like most general practices, have only been allocated a paltry 50 doses per week. We're in a position to vaccinate many times this number and we'll have to defer some of the appointments in the coming weeks due to supply issues. That said, we'll be doing everything in our power to have all children vaccinated who want to be vaccinated in January prior to school starting. We're now seeing many patients in consultation who have COVID. Although the number of ICU and ventilated patients and deaths are making the headlines, what we're seeing mostly is vaccinated patients who have no symptoms at all or who have flu-like symptoms, primarily fatigue, headache, nasal congestion, and in some cases fever. There's a document aimed at COVID patients on the RACGP website, racgp.org.au, called Managing COVID-19 at Home with Assistance from Your General Practice. It's a document that I would encourage you to take a look at in order to assist you managing your own illness at home. Moderately severe cases where you're very concerned about your health and your symptoms should be booked in for an appointment with us. Any severe symptoms such as chest pain or breathlessness, you should proceed directly to hospital. For any patients at high risk, such as in the last half of pregnancy, if you're immunosuppressed, if you have an active malignancy, morbid obesity, or are unimmunised, please do access early advice with regards to IV sotrovimab treatment through the local health service on 1800 960 933. Sotrovimab needs to be given within the first 5 days of diagnosis in order to prevent severe disease in the second week in our most vulnerable patients. This is not administered through general practice, but through the hospital system. Planning is key. Please make sure that you have enough sufficient regular medication in the home, as well as perhaps paracetamol, anti-inflammatory medication if tolerated, and Hydralyte or coconut water for rehydration. And this will give you the best opportunity to be largely self-sufficient in your management if your symptoms are mild. Please do not call us to tell us the date of your rapid antigen test. This is not an appropriate use of our services. This could be registered through the Service New South Wales app when the state government get it up and running, which is promised for Wednesday the 12th of January. A positive test will then link you into the system for treatment, if required, through hospital and for monitoring statistics for the state government. It's obviously not our role to be collecting statistics. We'll continue to see all patients through our telehealth portal until specifically invited into the surgery. There are no exceptions to this apart from childhood and COVID vaccinations. Wishing you all the very best to all of our patients for a happy and healthy 2022.